Okay, welcome to the Cancer Research UK Oxford Centre's open day for our DPhil in Cancer Science programme. My name is Mark Middleton. I'm a clinician, a medical oncologist, specialising in the clinical application of new drugs over in the cancer hospital. And I'm also the academic lead for the programme. I'm really pleased that you've joined us to hear more about it. We're very enthusiastic about it. It's one of the highlights of the CRUK Centre, and its success is entirely dependent upon getting you, the clever, new, bright young things, to engage with cancer and to train as scientists and clinician scientists of the future. So the Cancer Centre has a vision to develop clinical academics and scientists to establish a critical mass of clinical cancer researchers with the aim of accelerating cancer research and increasing its impact on patients' care in the hospitals that are also on our campuses. We're a collection of over 300 principal investigators in all sorts of departments across the university, principally obviously in the Medical Sciences Division and in MPLS. And we get about £4 million a year of funding from Cancer Research UK to support the centre, about half of which goes into the studentships that you're going to hear about today. What does this mean for our students being part of the CRUK Oxford Centre? Well, it's an opportunity to engage with research wherever you are in your clinical or undergraduate training, and take part in a tailored DPhil program, which will give you access to taught programs about cancer science and cancer care, and I'll talk about those again in a minute, and also access to some of the brightest and best clinicians and researchers working on cancer in the world. We want to put people in world-leading laboratories and train them up so that they're in a position to have an impact upon cancer care as they develop their own careers. And what we also want to do is to make sure that this is the start of a successful career for those who have the aptitude and the inclination to stick with the academic. And that includes strong engagement with the University Medical School's Clinical Academic Graduate Programme, and also the coordination of awards to keep going with science and academia after the DPhil ends and when you return back to clinical training or undergraduate medical training, if that's what you're doing. So you can enter our program as a clinical trainee, either by doing an intercalated DPhil whilst doing the undergraduate medical curriculum, or at any stage in the formal training that happens after graduation, be that the foundation years, the core training years, or on into specialist training. In 2021, we've got 4 studentships available for the intercalated pathway and 4 available for those who are already in clinical training. The Doctoral Training Centre in Cancer Science is intimately linked with both the Trust, Health Education England, the Clinical Academic Graduate School, and the university at collegiate, divisional, departmental level to provide strong mentorship and training throughout the 3 years of the programme. People who engage in it will have the pastoral support of a college, the technical and scientific support of their laboratory and department, as well as that one-to-one supervision from their PhD supervisors and academic oversight from people who specialize in integrating the academic training with medical education and training. As part of the course, we want to bring people up to speed with some of the core skills that they need as academics, be they core research skills, access to the ability to analyze very large data sets, and for those perhaps who it's been a little while since they've been to medical school, updates upon fundamental cancer biology. And all these are done through a seminar series, usually in the first term of the DPhil, where you'll also get to meet and engage with all the other people who are part of the CRUK Oxford Centre's DPhil in Cancer Science program, so that you can share your experiences, the challenges, and so forth. Also, as part of this program, there's education on how we treat cancer patients, be that with drugs, with surgery, with radiotherapy, and the underpinning laboratory medicine that goes with that. And then also we want to focus on how you turn research into an impact, by which we mean getting your cool idea into the clinic as a treatment or as a diagnostic, how ideas get commercialized, how they get developed to the point at which they become licensed and commissioned. All of these, of course, are only tasters, and depending upon the program that you follow, you'll experience more or less of those firsthand with the research that you undertake. We've got a fantastic wealth of departments in which our students have previously been placed. The Cancer Centre focuses upon fundamental cancer cell biology, the relationship between infection, immunity, and inflammation in cancer, and has specializations also in big data and in the application of engineering and physical science to medicine in the field. Scrolling beneath are examples of some of the departments or buildings where projects have been housed in the past or in the current project booklet. And it's really just to underscore that we're a very broad church. Our idea of cancer research is the broadest it can be, and the array of projects reflects that. There's something for everybody, I think. So how does this work? Well, we've already sifted through a number of projects that have reached and crossed the bar as being suitable as CRUK Oxford Centre DPhil projects. What we want from there is supervisors who buy into the ethos of the centre, which is built around multidisciplinary research with translational potential, but also very high scientific quality. So we're happy that all of the projects we've put forward meet those criteria. But what we're doing and will do as part of this program is to choose the best students to engage with those projects. Not all of the projects will get students because we recognize that we want to have as many options for you guys as possible. And it is sometimes possible for students to refine projects either before the point of application or more usually as they go along, because working at the cutting edge often leads you in interesting and unexpected directions. But what we're looking for from you guys is the research aptitude and motivation to take an interesting idea, to engage with it, to turn it into an answerable question and develop your skills to answer that question over the period of study. We're interested obviously also in your academic track record, as that's one of the bases upon which we can choose the best students from those who apply. We open for applications right through until the new year. You have to apply by the 8th of January. And we generally do our interviews in February, although that will be scheduled pandemic permitting and likely to be remote if the COVID situation calls for it, with a view to people starting around this time next year. And in fact, the people that we interviewed in February, just before the lockdown, have been starting in the laboratories in the last couple of weeks. So thank you very much for coming along. You're going to hear much more about the program in more detail now. So I'll step away and happy to take any questions, although perhaps they're better saved for a little bit later in the piece when you've heard a bit more. Thanks.